Hi, I'm Dr. Obinna Nwobi. This is The Anatomy of Relief, a comprehensive patient guide to uterine artery embolization, or UAE. It's a scientifically proven, minimally invasive pathway to treating fibroids and reclaiming your body. Let's walk through it together. Fibroids are far more common than most people realize. By age 50, up to 80% of women develop uterine fibroids, dense, non-elastic, benign, smooth muscle growths. Of that group, about 75% stay silent and never need medical treatment. But the other 25% become symptomatic, triggering severe, life-altering symptoms. And here's the critical distinction. Once fibroids cross that threshold from silent to symptomatic, watchful waiting is no longer enough. Your symptoms actually depend on exactly where the fibroid sits. Submucosal fibroids disrupt the uterine lining, leading to heavy menstrual bleeding, significant blood loss, and chronic anemia. Transmural fibroids cause diffuse pelvic pain, cramping, and heavy bleeding. Subserosal fibroids create bulk symptoms by pressing on surrounding organs, urinary frequency, constipation, back pain. And pedunculated fibroids fill the pelvic cavity, causing pain during intercourse and structural pressure. One more note, adenomyosis, a thickening of the uterine wall, mirrors these same symptoms, and it's also highly treatable. So why do fibroids grow unchecked in the first place? Estrogen is the primary driver of growth. Vitamin D acts as the body's natural brake pad on that growth, but deficiency is common. Melanin naturally blocks vitamin D synthesis from sunlight, which leaves Black women 3 to 9 times more at risk. Obesity also dilutes vitamin D in fat cells. This creates a cycle. Low vitamin D allows unchecked aromatase activity, which converts androgens to estrogen, which drives estrogen-fueled growth in a dense, low-oxygen fibroid environment, and that environment makes the fibroid even more resistant to treatment, while high-dose vitamin D can act as a biological preventative. Existing large fibroids often need a mechanical reset. So what are your options? On one end, pills and IUDs are non-invasive with zero blood loss and no hospital stay, but they fail to remove the existing fibroid bulk. On the other end, myomectomy and hysterectomy involve major incisions, real blood loss, and a 2 to 3 day hospital stay. Hysterectomy also means full organ removal, which is irreversible. In the middle is UAE, or embolization, a pinhole entry, 100% organ preservation, no blood loss, and it's outpatient and 0 hospital days while treating all of your fibroids simultaneously. Here's what makes embolization different. First, whole uterus treatment. We don't chase individual fibroids one by one. Treating the main uterine arteries addresses every fibroid at once. Second, it's minimally invasive. No major incisions, no Foley catheters, no groin entry. Third, it's outpatient recovery. Advanced nerve blocks and pain management let you recover in your own bed the same day. Fourth, it's highly effective. Decades of data show substantial volumetric shrinkage and symptom resolution for the vast majority of patients. And fifth, it's fertility preserving. Your uterus remains alive and fully intact, which leaves future pregnancy a viable possibility. Here's how it actually works. Your uterus has a vast redundant blood supply, but fibroids depend entirely on their own specific abnormal curly vessels. We navigate a tiny catheter about the size of an angel hair pasta noodle through the wrist all the way to those abnormal branches. Then we deploy microscopic particles precisely into them, blocking blood flow to the fibroids and starving them while the main uterine tissue continues to thrive. The procedure itself happens in a specialized angiography suite using real-time fluoroscopy to map your vascular system. The entry point is a single, roughly 2 millimeter pinhole in the radial artery at your wrist. For anesthesia, we use conscious sedation plus a targeted nerve block directly over the uterus to preemptively numb the cramping. Afterward, an inflatable wristband applies gentle pressure for about an hour. That's it. Zero groin entry entry, 0 Foley catheters, 0 blood loss. MRI imaging gives us concrete proof of what happens next. Over about 6 months, the starved fibroids die and soften, transforming from dense, hard tissue into small, harmless, fluid-filled cysts. Overall uterine volume shrinks by 40 to 70%, which immediately relieves the structural pressure on your bladder, bowel, and spine. What starts as an alive, active fibroid compressing your bladder becomes 6 months later an inert cyst. Let's talk results. 90% of patients see resolution of bleeding, heavy menstrual bleeding, and anemia typically resolve within the first 3 months after the procedure. 88% see resolution of bulk symptoms. Pelvic pressure, urinary frequency, and back pain are systematically eliminated as the fibroids shrink over 6 months. And long-term 10-year clinical data confirms that over 2/3 of patients remain highly satisfied with no further intervention needed. Now let's talk honestly about recovery. The natural death of fibroid tissue inherently causes some cramping and pain. Expect to feel like you have a severe flu or intense menstrual cramps for the first 24 to 48 hours. That discomfort peaks on day 1, and a rapid return to normalcy begins by day 3, with mobility and healing climbing back to 100% by day 7. Here's exactly how to get through those first 2 days. Heat and rest. Use a heating pad directly on your pelvis, stay in bed or on the couch, and aim to sleep through the peak discomfort on day 1. Aggressive hydration. Keep fluids coming continuously. Electrolyte-heavy drinks like Powerade, Gatorade, or bone broth help flush your system. Layered pain control. A high-dose NSAID, 800 milligrams of Motrin every 6 hours for 5 days, is your baseline, with prescribed narcotics used only as needed for the first 48 hours. And one critical warning on bowel management. Narcotics are powerful constipators. Plan to transition off them by day 3 and actively stimulate your bowels with things like Smooth Move tea, coffee, or magnesium citrate. You do not want procedural pain replaced by severe constipation. Unlike a hysterectomy or myomectomy, which require weeks of strict bed rest, UAE recovery requires exactly 1 week off work. On day 2, start ambulating around the house to prevent blood clots. Walk until you're tired, then rest. By day 7, you're back to work and your normal daily activities. For that first 7 days only, there are 3 temporary restrictions. Avoid sexual intercourse, avoid tampons, and avoid jacuzzis or soaking baths. After 1 week, all restrictions are lifted. Uterine artery embolization represents the pinnacle of modern image-guided medicine. It offers permanent symptom relief that used to be achievable only through major surgery. Combined with the elegance of a pinhole outpatient procedure, no hospital stays, no lost organs, just targeted elimination of the fibroids and a total restoration of your quality of life. If this sounds like it could be right for you, let's talk about getting you evaluated.